Hello and welcome to Weston Park Cancer Centre Radiotherapy Department. This is where your radiotherapy treatment will be planned and given. In this video, we're going to cover what will happen during the planning and treatment process and hopefully answer any questions you may have. When you arrive in the department, give your name to the receptionist and take a seat. Before you can begin your treatment, you will need to have a mask made, which helps to keep you still during the treatment. This involves coming to the impression suite within the radiotherapy department. This appointment is to take an impression of the area being treated using a thermoplastic mould material, which is a one-stage process and means you will only need one visit to complete your mask. A dosimetrist, the person who makes your mask and helps plan the treatment, will fully explain the procedure to you, and you will have the opportunity to ask any questions. Once you are happy to continue, the dosimetrist will then prepare you for the impression. You may have to remove your clothes above the waist, along with any necklaces or earrings. Female patients will usually be able to keep their bra on, and you will be offered a gown to wear. Depending on your treatment, you may be asked to remove any dentures. There may be up to 3 members of staff who will assist in taking the impression. When you are ready, you will be asked to lie down flat on the bed, and the team will guide you into the correct position for your treatment. The bed will then be raised to a height that a dosimetrist can work at. The plastic mask material is warmed in a special oven until it becomes very flexible. At this point, the material is draped over the area to be treated and smoothed into place by the dosimetrist. It will feel warm, but shouldn't be too uncomfortable. We will then use fans to cool the mask, which takes around 5 minutes. This causes the mask to harden. The purpose of the mask is to keep you still, so it should be a close fit to your skin. However, since you will have to wear the mask for around 10 minutes a day, it is important that you let us know if it is uncomfortable. Once both you and the dosimetrist are satisfied with the mask fitting, the mask is removed and you will be helped to sit up and escorted to your next appointment, a planning CT scan. One of the therapeutic radiographers will come and meet you and explain what will be happening next. The radiographer will take you into the scanner room and will help you into the position you need to be in for treatment. The radiographers will fit you in your mask on the CT couch. It is important to tell them if you are not comfortable prior to the scan, as they may be able to change your position slightly. Once in the correct position, a radiographer will draw with a felt-tip pen onto the mask, which you may feel. You will be taken further into the CT scanner and you must lie still but breathe normally. Sometimes the doctor may ask for a contrast dye to be injected into your bloodstream for the scan, which can help with the planning process. And if this is appropriate, it will be explained to you. The radiographers will leave the room and complete the CT scan from the control area. They can see and hear you at all times and can come back in the room and temporarily stop the process if required. You will move in and out of the scanner several times while all the necessary images are collected. Once the scan is complete, we'll remove the mask and you will be able to sit up. You will be given a list of all your appointments and the radiographers will advise if you are able to leave the department. Radiotherapy treatment will start around 2 to 3 weeks after this appointment. You will have a separate consent appointment to see the doctor or a member of their team. This appointment is to explain the radiotherapy treatment in more detail and go through possible side effects. A consent form will need to be signed if you are happy to go ahead with the treatment. Any questions can be answered at this point, so it may be beneficial for you to write these down before attending. At your first treatment appointment, a radiographer will meet you to explain what will happen in the treatment room, discuss again any possible side effects, and answer any questions you may have. You will need to be in the same position as you were for the CT scan, and the radiographers will help guide you into this position. The room lights will be dimmed, and the radiographers will move you and the machine into the correct position. You are asked to keep still and breathe normally. Once you and the machine are in the correct position, the radiographers will leave the room. Cameras are always operating in the treatment room, so if you require assistance, please raise a hand and the team will come straight in. The treatment machine will move around you and the bed may also move slightly. This is all controlled by the radiographers. You will hear the noise of the machine, but it will not touch you. You will not see or feel anything during the treatment. You'll be in the treatment position for approximately 15 to 20 minutes, but the treatment time itself is only around 2 minutes. You will receive the same treatment dose each time you attend. After the treatment, you can leave the radiotherapy department. If you have any questions, please contact us. We're here to help you every step of the way.